On today's Two on Your Side town hall, breaking down what the government's new COVID guidelines mean for you, how the guidance is different for asymptomatic people, and the role your vaccination status plays in it all. Plus, student loans and that huge relief last week. The government gave borrowers another big break in payments. We talked to an expert about what needs to be done to solve America's astronomical student debt crisis. And the Sabres are getting ready to resume their season that COVID interrupted last week. We'll talk about the state of the team and talk a little about the Olympics as well later on in the half hour. Thanks for being with us. We want to begin the town hall tonight with a deep dive into those new quarantine recommendations. The CDC now says anyone who is no longer showing symptoms of COVID-19 can cut their isolation time from 10 days to 5. We have heard from you, so we know you have a lot of questions about this. So let's first start with the specifics. The CDC says it's changing its recommendation because people are most infectious 2 days before they develop symptoms and 3 days after. The new guidance cuts isolation time for infected people in half. As long as you show no symptoms after 5 days, the CDC says you can return to normal activities after 5 days. You just have to wear a mask at all times. So if you develop symptoms during the 5-day quarantine, you're supposed to stay home until you feel better, regardless of whether you are vaccinated or not. If you have your booster shot, you can skip the quarantine period altogether as long as you don't have any symptoms. The CDC says you should just wear a mask whenever you're around other people. If you are unvaccinated or vaccinated but don't have a booster shot, the CDC says that you should quarantine for 5 days and wait for symptoms, just like if you have the virus. So joining us now is Dr. Thomas Russo. He's the University at Buffalo's Chief of Infectious Disease. We're glad you're here to help talk us through this. And when it comes to these recommendations, a lot of health experts say that this will help people get back to work, but there are others, Dr. Russo, that are against the move, saying that asymptomatic patients can still have and spread the virus beyond 5 days. So help us make sense of this, and what do you make of the changes here from the CDC?
Well, I think these changes are actually going to be helpful. It'll get people out of isolation and back to work sooner. So, Kate, let's start with a little terminology because this could be very confusing. The term isolation refers to individuals that actually have COVID. And as you mentioned, regardless of your vaccine status or your booster status, if you have COVID and test positive, you need to isolate for 5 days. And then if you're asymptomatic, you could get out of isolation. But the key piece of this, which I don't think people are paying enough attention to, is even though you're out of isolation, get out of jail, so to speak, after 5 days, you still have to wear a high quality mask that fits well for the next 5 days. So people are right, there may be a few individuals at the 5-day mark, even though they have no symptoms, that are shedding a few infectious particles. But if that individual then wears that mask, that'll stuff those particles and they safely could go back to work and carry on with their daily activities. Now, Kate, the term quarantine, that applies to people that have had close contact. So if you are fully vaccinated and you had close contact to someone with the booster shot, you do not need to quarantine. However, if you haven't received your booster shot and you passed 6 months for Pfizer or Moderna or past 2 months for J&J, or you're unvaccinated, you do need to quarantine for 5 days. And at that time, if you remain asymptomatic, then you could get out of quarantine.
There's certainly so much information for people to take in, and also there seems to be kind of a heightened awareness as well. And it seems like you can't get the common cold anymore without worrying, could it be COVID? And there are a lot of people who are sick right now. They're getting tested just to be sure. We wanted to take a look here at some of the common symptoms associated with the Omicron variant here. So there's a runny nose, headache, fatigue, sneezing, and a sore throat. But also, Dr. Russo, these are symptoms that can vary from person to person, which again just adds another layer of fatigue and confusion for people overall. So what do we really need to know here?
Well, unfortunately, COVID can mimic virtually any respiratory virus, including influenza, which is in our community. So it's critical if people have any respiratory symptoms at all, they want to get tested as soon as possible. And obviously, sorting out whether you had COVID is critically important, not only for your own personal health, you may be eligible for certain types of treatments if you're at high risk, and your healthcare provider could inform you how to best monitor your symptoms. But also, that'll allow you then to go ahead, if you're positive, to isolate, break the transmission chain, and minimize the risk of you infecting family members, other members in your household, or loved ones. So the key here is testing and early testing. The sooner you know what you're dealing with, the better one could move forward in terms of what's the best course of action for you as an individual and those around you.
Some good advice there. And on the note of what's happening here in our community, Erie County officials held their weekly COVID briefing this afternoon, and they announced that yesterday was a new record high for new confirmed cases at more than 1,300. The county executive shared the information that 20 to 39-year-olds are driving the recent surge, representing 46% of all new cases this week. So we're wondering what your reaction is to that, as well as the data showing hospitalization still trending down or flat day to day here, despite all those new cases. What is all this information telling us?
Well, unfortunately, we're in the midst of this Omicron wave, and the virus is evolving to get more and more infectious. And unfortunately, we're becoming a bit more complacent and letting our guard down more and more. And I think what we're seeing with these large number of cases is the result of holiday gatherings. Hospitalizations had been pretty good, Kate, but unfortunately, the numbers just from today, we flexed yesterday, we were up 30 hospitalizations. And so that's the first big increase we've had now in a couple of weeks. So with a large number of cases, unfortunately, is going to translate into a certain number of hospitalizations and bad outcomes. We've got New Year's coming up. This is not the moment to be complacent. And I know a lot of people out there have heard, Omicron, it's less virulent. It's not a big to-do to worry about. We are still learning about Omicron, but what is absolutely clear is this virus could still be deadly. And if we have large number of cases, it's going to catch up with a certain number of individuals, and that's primarily going to be the unvaccinated and those that are most vulnerable, our seniors and the immunocompromised, particularly if they haven't received their booster shot. So please, please, I know we're tired of this pandemic, but this is not the time to let your guard down, and we need to be very, very careful with the upcoming New Year's celebrations.
We've been joined by Dr. Thomas Russo, the University at Buffalo's Chief of Infectious Disease. Dr. Russo, thanks again for joining us. And I want to remind everybody, since we went through a lot of information here, you can always find these interviews on the WGRZ YouTube page as well if you want to check it out again. Dr. Russo, thanks again.
Always great to be with you, Kate.